I grew up with my grandpa. He had bipolar type 1, so I was around mental illness quite a bit. And I did visit him in the psych ward as well and kind of see other people with mental illness. And I remember not really understanding about it, not understanding what was going on with them, and kind of feeling scared at times. And then actually when I was 12 years old, my grandpa, he was 63 at the time, he did end up committing suicide. And he was someone who was very important to me, someone I looked up to, and he was a big part of my life before that. And it was just very hard for me to understand kind of why he did that. After not understanding for so long kind of what was going on with him, I actually kind of started looking into it myself and kind of learning more. And then I kind of found psychiatric nursing as a course in school. And so I looked into that and I was like, well, I really would like to do this because when I was so young, I wasn't able to understand or help my grandpa at all. So now I just want to be able to do that for other people. More awareness from a younger age, so that people already know before they get to that point, before they're already in crisis. And then once they're in that crisis state, it's harder to change once they get to a certain age.
My earliest memories when I was younger, probably about 5 years old, my mom had a bipolar 1 and she had her first psychotic episode. And I remember just going to the hospital with her and that day later on being told that we had to go to foster home because she was unable to take care of us. They always just told us that she was not well. So growing up, me and my siblings had to go to different foster homes when she was unable to take care of us, but nobody ever really explained to us kind of what was wrong with her. Never told us that she had a mental illness, what mental illness was. She was just told that she was unwell. So we grew up not realizing she actually had a mental illness, not realizing like when she's laying on the couch all day or having a psychotic symptom, like what to do or what that was. So very uneducated. That influenced my decision to become a psych nurse and to start a nonprofit organization because I seen the lack of education and lack of communication within the community, and I just wanted to be able to make a difference in someone's life in terms of being able to help promote mental well-being and destigmatizing. Nobody in my family wanted to talk about mental illness because nobody really knew much about it. I have children, so I'd like to see my children be able to grow up in a safe community, being able to talk openly about mental illness and spread the awareness of it. There's so many people that have mental illness and are afraid to talk about it. Mental illness is very common. So that's maybe like 1 out of 4 people will experience mental illness. And people maybe don't realize they have a mental illness because they don't know what the symptoms are. And we decided to start making t-shirts so we can sell. 100% of the proceeds go to youth mental health. We are going to schools, educating adolescents about mental health, and hoping to donate some resources to the community.
We've had parents come up to us, we've had booths at markets in the city, and they've come up and just shared their story that they're having struggles at home with their kids and they don't know where to look and where to turn, and they feel uneducated and they don't know where to go next. So I think that us starting in the schools, educating the kids, knowing how to help each other, how to speak up and where to ask for help has been really beneficial. With my 2 friends, Jennifer and Melissa, we've been able to expand our horizons. It's been a lot of work, more than we thought, but it's been really great.
So Own Your Story is about owning your story no matter what the circumstances. And then our arrow has 3 dots, so it's for 3 ladies that have a passion for mental health and supporting mental health and in the community. And the arrow is about moving forward and always moving forward, no matter what your circumstances.
Does it matter to you? No, because it has the topic.